help your patients take a long-term perspective on their oral health. For example, your goal is to help them keep their natural teeth all their life. Now, Naren, you'll remember when we did an episode about Dr. L.D. Pankey. And I shared some concepts about things I learned from Dr. Pankey. And if you remember, when Dr. Pankey moved to Key Biscayne, Florida, he became known as the dentist who would help you keep your teeth.
Yes, save your teeth.
And now this was in an era, in the late 1920s, where that wasn't in most people's perspective that you could keep your teeth all your life. But he became as known as the dentist that helps you keep your teeth. And I think if we take a long-term perspective and help our patients know what our goals are for them, keeping their own teeth for a lifetime, then we can keep them centered and keep them coming, on track when it comes to things like keeping their hygiene appointments or following your recommendations. And I think if the patient knows you always have their best interests at heart, they're never going to want to go anywhere else. I think there's a lot of suspicion out there today of healthcare, especially on the medical side. The average GP family practitioner, primary care medicine practitioner, MD, sees 80 patients a day.
Yes.
80 patients a day on an 8-hour day. That's a patient every 6 minutes. That's about enough time to pull out a prescription pad and write a prescription. That's about it. So there's a lot of mistrust. And I think we can change that in dentistry. I believe there's a lot more general trustworthiness of patients towards their dentist than there is on the medical side. So takeaway number one, help your patients take a long-term perspective on their oral health. For example, let them know that your goal is to help them keep their own natural teeth all their life. And I would say right behind that is, if you were the patient, Naren, we need your help, Naren. You can't do this by yourself. I'm going to need your help. I'm going to need you to do good home care and also be faithful about keeping your appointments in our practice. Naren, does that sound like a fair trade?
Absolutely. I mean,
hey, I'll do my part if you'll do yours, doc. Right?
Listening to this episode, it just, it's kind of something that I have realized over the years. The older we get, the more seriously we take health. And I'm a testament. Like, I always ignored health, and I had reasons and excuses and explanations why it was not important. But now I'm pretty picky on what I eat and my exercise and all these things. And I think there's a large number of people who feel the way I feel, like health is important. So
there's an axiom around that, Naren, that says when we have health, we take it for granted.
Mm-hmm.
But when we lose our health, it's the only thing that's important to us.
Right.
I think of someone that, from afar influenced me, and that's Steve Jobs. And when Steve Jobs had his health failures late in life, and here's someone that had all the money in the world.
Right.
But what didn't he have? He didn't have his health.
Health, yeah.
And what mattered at that point was what? The fact that he didn't have his health.
Right.
I think you're right. I think you speak you speak wisely about that. You're right.